At our company, we offer membership, and we call it the 100-plus membership. And I really think that 100-plus is a floor, not a ceiling. And I think I can credibly say that because, if you look around the globe, there's 5 blue zones where people live organically to the age of 100 without all the fancy diagnostics, with MRI machines and whole genome sequencing. And, a lot of these blue zones have in common social interaction and movement, a number of other things. But if folks can live organically to the age of 100, there's no reason why members can't get to 80 or 90 or 100 healthily, and especially with the advancement in diagnostics. I also just wanted to talk about probably some statistics that unfortunately you're well aware of, which is that in the United States, if you live to the age of 50, you have a 1 in 4 chance of not making it to age 75. Now, globally, it's worse. It's 1 in 3. But this is in spite of spending $3.7 trillion US dollars on our healthcare system, which is 17% of GDP and growing. Most economists think it's going to grow to about 25% of GDP. It's really unsustainable. We spend way more than other, advanced countries, way more than European countries and Asian countries who have higher life expectancies and spend far less. So something is not right. Our return on investment is not a good one. You don't have to trust me on this, right? By the way, the other bad fact associated with that spend, that 3.7 trillion spend, our lifespan in this country, and this preceded COVID, has actually been declining. So it was around 80. Front page of the Washington Post 3 days ago, it's about 75 now. Again, that preceded COVID. But for a country that spends 3.7 trillion US dollars on a healthcare system, that should not be so. So, why is this with this incredible spend that we have such poor outcomes? It's because we really, unfortunately, don't have a precision medicine-based healthcare system. We don't have a wellness-based healthcare system. We, in fact, have sick care. And sick care, actually, we have the best sick care in the world. So if you have, end-of-life disease, there's probably no better place on the planet if you have stage 3 or stage 4 cancer to come in the United States. But if you want to get to the age of a 90 or 100 healthily, at least right now in the United States, that's not our expertise, and we're trying to change that. So this is bladder cancer. I'm an imaging guy by training, radiologist. So this is an image of late-stage bladder cancer, but this is how bladder cancer presents, and unfortunately how most cancers present, right? It's stage 3, stage 4. This is already invaded in that left image there through the bladder wall. Obstructing the ureter, and the quality of life for this individual and the overall outcome is not a good one, and by the way, at great cost. That center slide is how we've identified in 5 of our clients, and we've seen 8,000 members over the last several years. That's how we've identified early non-muscle invasive bladder cancer in 5 of our members. And that can literally be treated inexpensively with very little morbidity. These members went back to work almost the next day because this can be removed by a urologist with cystoscopy and literally scraped off the muscle of the bladder wall. That's whole body MRI. It's not a PET CT or a PET MRI. That's our non-contrast whole body MRI. What we're really moving to as a company, and we're really where our healthcare system needs to move as well, is this what we call sort of precision medicine 2.0 or longevity care 2.0, which is this idea of previvership. It's the idea that when you come through our assessment, we're providing 150 gigabytes of data. It's genomic data, it's imaging data, it's blood data, it's wearable data. How can we predict your 10 or 20-year risk for bladder cancer or other common chronic age-related disease so that we can get ahead of it so that you don't get it in the first place? But we really think at scale. Now, right now, we are serving mostly high net worth individuals, but as our costs come down, as we democratize our offering, we really believe that we can show the world what true value-based care looks like, which is really all about improving outcomes while controlling costs. We've invested greatly into research and development over the years, especially in the genomic sciences, the imaging sciences, metabolomic sciences, and that all accrues to the benefit of our members. We've seen over 8,000 members so far. And the story of our company is that we're deeply rooted in science and that we will continue to be. There's a lot of noise in the longevity space. And, you hear of companies cropping up here and there promoting really wild and crazy things. We like to say we're on the bleeding edge, but not the lunatic edge. We published over 60 publications over the last few years, high profile journals. And this is really kind of what we do and how we do it. So instead of, all of you have been to your primary care physician and you know what that dopey, superficial physical exam looks like. It hasn't changed over the last 30 years, what I learned in medical school. And to be honest, if you ask most primary care doctors whether they think it's really doing anything, and they're honest with you, they'll tell you no. What we do instead, we do a whole body MRI instead of a superficial physical exam. Instead of saying, hey, what did mom and dad have in terms of understanding genetic risk, we do literally sequence all 6 billion base pairs of our members' genome. We do metabolomics, we do wearables, and we integrate that, yes, with a precision medicine physician, but we also integrate that with AI and machine learning. That's an important part of what we do. So this is just one of the many publications, again, high-profile journals, and that initial story of someone presenting, at the age of 60 or maybe in their 50s with a severe heart attack, showing up in the ER with late-stage cancer, a heart attack or a stroke, or an aneurysm that's ruptured, and you say, well, how did this happen? This person was at the height of their game. They were so healthy, had no idea. And, that's actually what we call sort of presumed healthy. And in fact, when you look deep enough, if you look, with the Hubble telescope, not a flashlight like we do, you can see, in fact, that some of these presumed healthy folks are not so healthy after all. So what this paper showed, when we looked at the first 1,200 clients, members who came through, what we actually saw in these 1,200 presumed healthy individuals was that 14% had life-altering findings that needed to be dealt with in the next week, and 40% had clinically significant findings that were important, that were not previously known. In all cases, these were not previously known, but that were highly actionable. So 1 in 50 with early-stage high-grade tumors, 1 in 50 with brain and aortic aneurysms, nearly 10% with early actionable coronary artery disease, again, not previously known. 1 in 7 with rare genetic mutations like BRCA mutations, that if you know about them early enough, you can do something about it, like earlier screening or more frequent screening. The reality is some people would look at this and say, well, I want to know about this stuff like I want a root canal, right? But the reality is you do want to know about these data, because if you know about these data early, they're highly actionable. And that's the key to this. With early detection comes the opportunity for early intervention. And, these are just some of the dramatic, stories of our members. And every day between the two clinics in San Francisco and San Diego, we have a life-altering finding. A woman in her early 50s with an early-stage lung adenocarcinoma would have no reason to be screened for lung cancer. She was a non-smoker, and a week later, this was resected at Cedars-Sinai. And again, these images here, all from our non-contrast MRI. There's no radiation, there's no IV contrast, totally non-invasive. The ability for a non-contrast whole-body MRI to find early-stage disease is really unparalleled. That image there is an unruptured aneurysm that can be treated non-invasively because we found it early, found it before it ruptured. And, by the way, it's not just folks in their 50s, 60s, or 70s, because disease, common chronic age-related disease, starts in your 20s and 30s and your 40s. So if you have a massive heart attack in your 50s, you've had that process brewing for about 20 years. You just didn't know about it. So the other thing that we do is really use AI and machine learning. And so it's not just about what is your current health status, but as importantly, it's really about, look, based on all the data, the 150 gigabytes of data, what is your 1, 5, 10, 20-year risk for common chronic age-related disease? And if that risk is elevated, how can we look at your modifiable risk factors to get that risk down? And by the way, not population risk or relative risk, your actual annualized incidence, your risk, right? Your personalized risk based on all the data. That's what you want to know about, not relative risk or population level risk. And then if that risk is elevated, how do we work with you to get that risk down over time? Maybe you don't get the disease in the first place. We've done that with Alzheimer's, roughly 10-year pre-symptomatic risk predictor. We really do this for all the common chronic age-related diseases. We have enough data. Let's look at it. Let's get ahead of it. You all know where healthcare is today. You know what that looks like. We talk about the 5 Ps of precision medicine. I think personalized is the most important of those. And that's what we really do in our company and what we offer to our members. We do have a partnership with a number of really incredible academic medical centers all over the world and all over the country. The most sort of robust partnership that we have is with Mass General Hospital. And this allows all of our clients, all of our members to have access to the subspecialists at Mass General. So look, if we uncover a serious disease or condition, we can often be in touch with the specialists at Mass General in the next week or two to make sure that you're getting the best evaluation and the best care pathway based on the data that you could possibly get. So our creed and our mission and vision, even though we're human longevity, it's really not as much about longevity as it is about health span, right? And so our whole concept is, look, we don't want to just give you another 10 years. It's how do we give you another 10 plus high vitality years, 10 plus high performing years, managing the trajectory of aging to get you another 10 plus high quality years. And that's what we're all about. But look, those blue zones show, the 100 plus should really be the floor, not the ceiling.